Hi there, my name is June. Today I'm going to show you a demonstration of a subcutaneous injection of insulin and how to prepare that safely and the steps we take to make sure we are safe in preparing and giving this medication. Okay. So if you follow me over here, you can see I have this is going to simulate my medication station or my Omnicell or my med cart, and if you look behind me you can see that I have a patient room with a patient to differentiate and make it a little bit of a better story for you, so you don't see me just doing all of this in one room. I want to see you move back. I want you to see me move back and forth between this demonstration to show how the rights and the checks all come together in this skill. So for starters, let's follow through with that same scenario. We've arrived to our shift in the morning. We discover that one of the patients on our load has a newly written doctor's order, and it has been transcribed before we arrived. So there's a set of steps that we are responsible for in order to follow through with this doctor's order. The first steps are, of course, hand hygiene, and then we're going to make sure that our doctor's order has all of the components that make it complete and accurate. So the components of a doctor's order are the patient name, the drug, the dose, the frequency, the route, the doctor's signature, and of course a current date and time. And so if we take a look at our doctor's order, and I always want you to be a top down, be systematic, and start at the top. We're going to start with our patient name, Jessie Moore. We have a health card number, and we have a date of birth. I can see next that there is no allergies, so Jessie's not allergic to the drugs that we're about to give so far. And as I move down to my first drug for today, because we've already done these, we're going to take a look at our insulins. And so the first doctor's order says to give 6 units of insulin R sub-Q before meals and at bedtime. So I have patient name, I have the drug, I have the dose, I have the route, and I have the frequency, and I have a doctor's signature. And then we're going to be mixing insulin, so I have the second order. I have patient name, and I have any allergies, and I have a health card number. I have the drug name, I have the dose, I have the route, and I have the frequency, and I have a doctor's signature. So the components are all there for my doctor's order. I don't need to call the doctor back and clarify anything, which is exactly what I'd have to do if all those things weren't in place. So my next step, and this always follows through, check your doctor's order, then you compare it to your MAR, your medication administration record. And so if we take a look now and compare those things, if we start at the first drug, it says give 6 units of insulin R. Oh, of course, I'm going to check first to make sure I have Jessie Moore and I have a date of birth and no known allergies. And then I'm going to move down and see that my first drug is insulin R, 6 units, 6 units. The route is sub-Q, subcutaneously. The frequency is before meals and bedtime. Before meals and bedtime. It's been checked by 2 nurses and their master signature is signed. And then if I move right down to my second drug, I have the right patient and I have the date of birth and I have no known allergies. Move right down to my second drug, I have insulin NPH. The dose is 14 units, I have 14 units. The route is sub-Q, I have sub-Q. The frequency is before meals and bedtime, It's been checked by 2 nurses, and they both signed the master signature. So my MAR has been transcribed accurately. I can put my doctor's order away now, back in the patient's chart, and I can work just solely from my medication administration record or my MAR. So the next thing that I'm going to do, and this is always the same sequence of events, doctor's order, compare it to the MAR. Now I want to educate myself about this drug. You might be the nurse who is going to be teaching a newly diagnosed diabetic about insulin. And so before you can educate your patient and before you ever give any kind of a medication, you need to know what you're giving and why you're giving it and what it's for and everything that goes with that medication. So you're going to get out your drug guide. Davis Drug Guide, Mosby's, whatever the guide is that you are using to check your drugs, get that out. You're going to check what it's for. You're going to make sure that it's compatible. For example, today we're going to be mixing R and N. We're going to make sure that we can mix those two insulins. We want to find out, for example, insulin R is a faster acting insulin. We want to find out how quickly that acts. So we want to know that breakfast is handy, but really what's most important there, or more important, is we need to know what Jesse's blood glucose level is. You never ever give insulin to anybody without checking a blood glucose level, no matter what anybody tells you. That is your practice, and you can cause serious harm to a patient by giving insulin when their blood sugar is too low. So you're absolutely going to obtain a blood glucose reading before you ever give insulin. So after we're done with the drug guide and we've learned all of the things we need to know, we know the signs and symptoms of blood sugar that's too low, we know the nursing implications, we know the checks we should do, which is checking our patient's blood glucose level. Then we're going to check our patient's chart, and we're going to find out the right reason. Is this a newly diagnosed diabetic? Is this brand new, or is this something that's ongoing and our patient just requires assistance with this because they're, for whatever reason, unable to manage their own insulin? And when we're happy with all that, then it's time for us to go in and meet our patient and do some assessment and baseline. So I'm going to go ahead now and go to my patient's room. If you'll follow me, please. So as I enter my patient's room, I'm going to do hand hygiene in front of my patient. And I'm going to say, "Hi, Jesse, my name is June, and I'm going to be your nurse today. Can you please tell me your full name and your date of birth?" And he's going to say his name is Jesse Moore, and I'm going to compare that. Okay, it says Jesse Moore on your name tag and your date of birth. He's going to tell me it's April 2nd, 1998, and I'm going to confirm that on his name band. That's great. Now I know I have the right, I have Jesse Moore, I have the right patient. And so then I'm going to proceed to give Jesse the right education and explain that the doctor has ordered these two types of insulin. One is a quicker acting and one is a little longer acting. I'm going to give him all of that information, find out how he feels about that. I'm going to ask him any questions, if he has any questions about insulin. And then I'm going to ask him if I can please take his blood glucose reading so that I can know whether he's in a safe zone or not for me to administer this injection. And so I'm going to go proceed with that skill, and then I'm going to ask him if that's okay. Can I proceed and go fix your insulin? And he's going to either have the right to refuse or he's going to consent. And so Jesse consents, and when I'm happy with all that and he's happy, I'm going to tell him I'll be back in a few minutes. I'm just going to go prepare your insulin, and I'm coming back to my med room. Back in my med room, I have gathered my supplies. I have insulin R and I have insulin N. I've checked the expiries on those both to make sure they're okay. I'm doing some hand hygiene before I touch my equipment, and I've also made sure I have a clean surface to prepare these medications on. So now let's talk about our 3 checks and our 10 rights. We have 2 medications. Those 3 checks apply to each medication independently as we go through our steps. And so my first encounter with this medication is my first check. So I'm going to start from the top. I'm going to start with Jesse Moore. Do I have the right patient? Yes, I do. I just came back from having a discussion with Jesse Moore, checked his armband. I know it's Jesse. Do I have the right drug? My MAR says insulin R. My vial says insulin R. I don't have the correct dose yet, but I will as I go along. And I'm going to have a second nurse, or I'm going to verbalize that I would get a second nurse to check my dose each time. I have the right route subcutaneously. I know that. I've checked his blood glucose level. It's above 5. I know it's safe for me to give this dose of insulin to Jesse. He's consented. I know the right reason. He has the right education. All of those rights have been applied. That's my first check on my first drug. I'm going to do the very same thing with my second drug. So I have insulin N. I'm going to start at the top. Jesse Moore, yes, I have the right patient. I have the right drug. I don't have the right dose yet. I know the right reason. I've given him the right education. I've given him the right to refuse. The documentation happens at the end when I sign my MAR after I've given my medication, and evaluation is ongoing. It's happening all the time in our nursing process. That's my first check of my 2 drugs. So I'm ready to start, begin preparation. Our second check of our medications happen during preparation or at some point in preparation. I think it's fine to do whatever works for you. I'm going to go ahead and take a swab here, and I'm going to swab both of my vials, give them a good scrubbing. And while I have it in my hand, I'm going to go ahead and do my second check while it's drying. And I'm going to start right at the top. I have the right patient. I know I have the right drug, insulin R. I don't have the right dose yet. I've given Jesse the right education. I know the right reason. I've done the assessment. I've gotten the blood glucose level. I'll do the right documentation after I've given it, and evaluation is ongoing. Let that one continue drying. I'm going to grab my second medication. I'm going to do my second check after I swab it here. And then I'm going to do the same thing. I'm going to start at the top. I know I have the right patient. I have the right drug. It's insulin NPH. I don't have the right dose yet, but I will, and I'll get a second nurse to check it. I've given Jesse the right education. I know the right reason. I've given him the right to refuse. Documentation will happen at the end, and evaluation is ongoing. There's 2 solid checks. I'm feeling really good about my safe medication preparation here. I'm getting ready to prepare my medication now. So again, we're working from a vial. That's a closed system. It's under negative pressure. And so we're going to have to add air to our vials before we drop our medication. And so we just work in the reverse. We want to stick this sharp needle in the vials the least amount of time so that it's nice and sharp when we go to inject it in our patient. We want to keep it nice and clean and as sharp as possible. So I'm going to pull my cap straight off and away, and it has a flat bottom. It can stand up, so when I need to recap it, I can just line that up and recap it. It's a very small needle. It's a very thin needle. It bends very easily, so we have to be very careful with this is a quite big vial for a tiny little needle like this. So we always draw up, aspirate the medication out with mixing insulins, clear before cloudy. So if I'm going to be drawing up the clear first, I need to work in reverse and add the air opposite. I want to finish over here with my R. Okay, so there's my cloudy. I've rolled it. Just to make you can see the cloudy. And so I'm going to start by drawing up my air for my cloudy. And if I look at my MAR, it's 14 units of NPH. So I'm going to draw up 14 units of air. I'm going to stabilize my vial, pierce the top, and be careful with that needle because it's so fragile. And then I'm going to inject my air and pull that out nice and straight. And then I'm going to go over and add, I need 6 units of clear, the R, so I'm going to add 6 units of air. And I'm being careful not to touch the plunger, just the end here. And that little white arm will move all around so that you can look at whatever increments you want, whether they're odd or even. I'm going to draw up 6 units of air. So now I'm getting ready to draw up my medication. I have 2 checks done. So I'm going to pierce the top. I'm going to inject my air. And now I'm going to invert the whole unit. And I'm going to be really careful to stabilize this whole unit so that I don't bend that needle. So I'm turning the window towards myself, but it doesn't matter because that needle is so tiny that it's just barely on the other side of that rubber stopper. And I'm going to draw up my 6 units. And so remember that little needle, even though it's small, it has air in it. So I'm just going to pull back. This is my only opportunity to prime that needle. And I'm going to draw up. I just have to turn this to myself for a second here, guys. 6 units. This is where I would get a second nurse to check my dose while it's right here on the vial. The vial is right on top of the syringe. The second nurse can come over here. The second nurse can look at this medication administration record and see that that's insulin R. June is holding insulin R. The MAR says 6 units. June has 6 units. That's safe and good to go. So I can go ahead and set everything back, pull the needle up out of there nice and straight. So now I have 6 units. There's no air in there. That little tiny needle got primed because I pulled back a little extra and pushed back into the vial. That's fine to do with your first dose. You have not mixed anything yet. But now we're about to mix, and so you have to be very accurate with this second pullback because you can't inject anything into the vial. That would change the concentration of everything. It would change the concentration in your syringe. You'd have to discard and start over. So I'm ready to go ahead, and actually while I'm right here, I think I would finish my third check with my insulin R while I have it right here with me before I move on. So I go ahead and start at the top with my right patient. I know I have the right patient. I have the right drug, insulin R. I know I have the right dose now, and a second nurse checked my work. So I have 6 units, that's the right dose, and I've given Jesse the right education. I checked his blood glucose level. I know that he's taking this for the right reason. It's because he's a diabetic, and so that's my third check with that first drug. I'm done with that first drug. Now I'm ready to go to my second drug, and I'm going to draw up the remaining 14 units for a total of 20. So my syringe is going to end at 20. So I'm going to very carefully just invert everything. I have my cloudy here. You can see it's cloudy. And I'm going to stabilize the whole unit. You can see how I'm keeping everything nice and straight. And that just comes with practice. And I'm going to go ahead. I'm going to turn this just so I can see. And I'm going to very carefully draw that. Just take your time and go slow. That's how you avoid bubbles and air. And it's how you avoid not overshooting. So you can see where that little 20 increment is. I'm just going to pull down nice and slow. And you can see there's 20. And so I'd get a second nurse again to check that dose for me and make sure I had 20. She would do that math in her head again and say, okay, June has insulin and pH. That's what the MAR says. It's 14 units. I watched her draw up the 6. 6 plus 14 is 20. She has the right dose there. So that's my second nurse checking my work. Absolutely essential. And so now I'm going to do my third check. Now that I have drawn up my second medication, I'm going to do my third and final check with the second drug. So I have the right patient. I know that Jesse is taking this medication for the right reason. It's because he is diabetic. I've done the proper assessment and education. I've taken a blood glucose level and checked and made sure he was above 5. Safe to give. I know breakfast is coming. And I have given him the right education and the right to refuse. He's good to have this. He's okay with that. He's given his consent. And so I'll document that after I've given it, and I will continue to evaluate after I give the medication and then during my shift. So that's my third and final check. I can recap this now. So that little white arm lines up with that little orange opening in the orange cap. I'm just going to push that down. And so my syringe is ready to go. I've done my 3 checks. I know I have the right dose in there. So now I'm going to go ahead and take my gloves. And I'm going to take an alcohol swab, my syringe, my pen, my MAR, and I'm going to head to my patient's room. And as I enter my patient's room, I'm going to close the door. I'm going to pull the curtain. I'm going to set my stuff down, and I'm going to do hand hygiene in front of my patient. Hi there, Jesse. My name is June, and I'm back. We had a discussion about your insulin. I checked your blood glucose level. Can you please tell me your full name and your date of birth? And Jesse's going to tell me again that his name is Jesse Moore, and he was born April 2nd, 1998. I'm checking it on the name band, and I am further confirming it on the MAR. So important after you've done such a great job making sure you have checked and checked and checked your medication. You know you have the right medication. Make sure when you come into the room and there are 4 people with the same name that you have the right patient with the right health card number and date of birth on there from your MAR. So after I've made sure I have the right patient, then I can say, are you still okay to take this injection? And he will discuss it if need be, and he'll consent, and then we can go ahead and prepare that. So I'm going to go ahead and put my gloves on, and I'm going to, I think I'm just going to grab my injectee pad, and we'll come over here and pretend we're in the patient's room. and I'm going to swab a big 5 centimeter circle. I could give this in the lateral aspect of the arms, as we discussed. I can give it anywhere in the abdomen, 2.5 centimeters away from the umbilicus. And Perry and Potter 2020 now says that rotating from arm to arm and abdomen to thigh is no longer necessary with insulin injections. We can predominantly rotate around the abdomen 2.5 centimeters away from the umbilicus. So I'm going to swab a nice area. I'm going to put that between my fingers so that it's there and easily accessible for me. I'm going to pull that cap straight off and away. I'm going to pinch a good 5 centimeter fold of skin. That means I can inject at a 90-degree angle, so 5 centimeters, I can inject at 90. 2.5 centimeter fold, we're going to inject at a 45. I can inject at a 90 because I can easily grab a 5 centimeter fold of skin. That needle is very, very fragile, so I'm going to be careful. I'm going to inject right to the hub. Let go of the pinch, unless it's heparin fragment. Stabilize the needle. We always stabilize the needle. Inject our medication. Wait a few seconds. Pull the needle straight out and away. Let the swab fall right down on the injection site. Lock our needle with our thumb. That's a one-handed motion. That's a safety lock. Apply gentle pressure for 10 seconds. It's all good. We can put our needle in the sharps container. And we can put our garbage in the garbage. I'm going to remove my gloves. And I'm going to perform hand hygiene. And I'm going to stay with my patient, and I'm going to talk to him, make sure he's feeling okay for a few minutes. While I'm talking to my patient, I return him to a comfortable position. If it was his abdomen that I had exposed, I'd cover him, make sure he had his call bell, pull his bedside table in close to him, give him anything that he needs to be comfortable there. Put the bed down to the lowest position. I can go ahead and sign my MAR and my master signature. And I can pick up my garbage. I'll tell Jesse that I'll be back in a few minutes to check on him, make sure he's still feeling okay. He can call me at any time he needs to if he's not feeling well. And throughout my shift, I'd continue to check on him, and if there was anything wrong, I would document that in my nursing notes. And I think that's it. That concludes our demonstration of an insulin subcutaneous injection. Thank you.